Patty Bloom. I'm an assistant professor and transplant hepatologist at University of Michigan. And today we're going to talk about how you can avoid future visits to the hospital. So the first piece of advice I'll give is that you should have absolutely no alcohol. Now, that is even if your liver disease is not from alcohol. So even if your liver disease is from fatty liver or viral hepatitis or any other cause, there is unfortunately no safe amount of alcohol that someone with cirrhosis can have. And that's just because there's not a lot of healthy liver tissue in a liver with cirrhosis, and alcohol, even in small amounts, can really damage that remaining healthy tissue. It's also important to maintain a healthy body weight as much as possible. The liver really reacts to the body's overall metabolism. And when people are overweight or obese, it has a negative impact on their liver. So if you are overweight, it's a good idea to talk with your doctor about safe ways to try and lose weight. It's important also to stay physically active. So the liver really benefits when people have a lot of muscle mass, actually. The muscle actually helps to metabolize and get rid of some toxins in the body that can build up when people have liver disease. So it's important to stay physically active, whether that be cardio type physical activity or weightlifting, really anything that gets your heart going and gets you sweating, that counts as physical activity. And then another strategy is to treat any underlying liver diseases you have. So whatever it is that is, causing your liver disease, whether it's alcohol, whether it's fatty liver, whether it's viruses, or other causes, really make sure with your doctor that those conditions are being treated as best they can. So here are some triggers for hepatic encephalopathy that lead people to sometimes needing to get admitted to the hospital for that condition. The first is infection. It's hard sometimes to avoid infections, right? Like, I think no one's asking for an infection. But there are things that you can do to avoid getting them, right? If you know one of your family members or friends is sick, avoid them while they have that illness. Use good hand hygiene. If you're in areas where there's lots of crowds, maybe try to avoid those crowds. Wear a mask if you're in a crowd, or certainly if you're at the airport, places like that. Avoid dehydration. So dehydration can cause people to become confused, and can bring on that hepatic encephalopathy. And that dehydration sometimes comes when people are having too many bowel movements. So make sure that you're chatting with your doctor about how to avoid dehydration. Kidney injury and constipation, sedating medications, those are all things also that can trigger confusion. So make sure that you're having regular bowel movements, but not too many, not more than 4 a day. And sedating medications include things like sleeping pills, pain pills. Trying to avoid those can also prevent hospitalizations. So lactulose is the main medication that treats hepatic encephalopathy. It works. It works really well. We've been using it for decades, and we know that it works. It helps to purge the toxins that build up in your blood because of having liver disease. And you can adjust the dose if your doctor agrees. A lot of patients will kind of learn their own dose adjustment over time. They take enough to make sure that they're having 2 to 4 bowel movements a day. Rifaximin is a second medication that also works to treat hepatic encephalopathy, and it prevents people from getting hospitalized. It's a pill that's twice a day. You take it twice a day, once in the morning, once at night. And it also works to get rid of toxins from the gut. It doesn't usually cause diarrhea or loose stool. It's not a laxative like lactulose is. And you might find that at first, this medication looks to be very expensive, but your doctor can write what's called a prior authorization to your insurance company to get more of that medication covered and to get it to be less expensive for you. The other advice I'll give is that you should eat a high protein diet. Okay. Your body's muscles play a big role in cleaning out your blood. And we need to support your muscles by feeding them enough protein. The general amount of protein that's good for you to take in is 1 gram of protein for every kilogram of body weight. So I've converted that here in this table to pounds and kilograms. So, for example, if you're 132 pounds, you should eat 60 grams of protein a day. If you're 220 pounds, you should have 100 grams of protein a day. And this table gives you some ideas of some foods that contain a lot of protein. And then lastly, I'll say again, avoid sedating medications. So benzodiazepines are a type of anxiety medication that helps with sleep and anxiety, but they can really cause worsening confusion. And then opiates are a type of pain medication that can also contribute to confusion. And it's possible that you used to tolerate those medications before you had encephalopathy, but now they really contribute to leading to more confusion. So avoid these if possible, use alternatives. I hope you found that advice helpful. Thank you for listening.